This is a special report from WDHN News.
I'm Amanda Arnold, bringing you a WDHN News special report from Montgomery, the Alabama state capital, where Governor Ivey is about to hold a joint press conference to provide a COVID-19 update. She will be joined by State Health Officer Dr. Scott Harris.
Everyone, thank you so much for being here. We're here to speak about our Safer at Home order. But first, I want to thank every Alabamian, each and every one of you, for doing your part, for practicing the guidelines and the personal hygiene, and for paying attention to help us combat this awful virus. I know it's been tough on y'all, but y'all, it ain't been a picnic for me either. And I so appreciate the personal sacrifices that each of you are making and will continue to make as we get through this situation. We must keep our people safe and healthy. As hard as it's been, we're here today to report on our progress in our state's effort to combat the COVID-19 virus and the next steps going forward. Our current Safer at Home order will expire May 15th. However, today, I'm expanding this order and the list of what reopens under the Safer at Home order. So starting this Monday, May 11th, this order is amended with expanded openings that will go into effect during the next phase of safely reopening Alabama and will continue until May 22nd. Because I know how the people of Alabama are responding and paying attention while heeding the good public safety and health warnings, Dr. Harris and I are comfortable that we'll be able to continue a measured approach. But let me be crystal clear to the people of Alabama. The threat of this disease continues to be active, and it is deadly. During the last couple of months, we've lost friends and family members to this awful virus, and more than 369 of our fellow Alabamians have died from this virus. Even more disturbing nationally is the number of deaths that have occurred nationwide during the virus during the past 7 weeks is more than occurred during the 20 years of fighting the Vietnam War. Our record-breaking economy just 2 months ago had the lowest unemployment rate in Alabama history at 2.7%. Sadly, this seems like a distant memory. In February, one of our top challenges was that we had more jobs than we had people to fill them. And today, more than 400,000 people are unemployed. They filed their claims with the Department of Labor. Y'all, these are innocent people who've lost their jobs, and many of them are folks who are accepting government help for the first time in their lives. People are frustrated. I understand. I care about you. We hear your voices. We know you're frustrated, and today's order will hopefully begin providing another round of hope for all of us. Sadly, more people have filed for unemployment during the last 6 weeks than during the previous 2 years combined. Truly, this is heartbreaking. While remaining true to our focus on our physical health, we are also acknowledging that more can be done to address our economic health as well. Last week, I spoke about how our state eased a stay-at-home order. Rest assured, we're trying to be just as thoughtful and careful as we ease back in to more social interactions while maintaining a 6-foot distance. Our new amended Safer at Home order that has expanded reopenings will still require social distancing and urge everyone to continue to taking all health precautions as we return to whatever normal may look like in the near future. As individuals, and especially vulnerable people, these are encouraged to exercise personal responsibility in slowing the spread of the COVID virus and minimizing travel outside the home. I've said it numerous times, and I'll say it again, but if I weren't governor, I sure as heck wouldn't be with y'all today. You will continue to be encouraged to wear face coverings around people from other households when you leave your home and maintain proper hand washing and good hygiene. In a nutshell, here's what's new about our amended order. All non-related work gatherings of any size that cannot maintain a consistent 6-foot distancing will be prohibited. This differs from the previous order that limited group sizes to 9 or less. Beginning this next Monday, May 11th, restaurants will be able to open at a 50% occupancy rate with a 6-foot spacing between tables and other guidance that has been agreed upon by the Alabama Restaurant and Hospitality Association. Barbershops, hair salons, nail salons, and other similar type establishments will be able to open up with restrictions, again with guidelines that are developed by the State Board of Cosmetology. Gyms, athletic facilities, and athletic classes may resume, and this is key, but they will be under strict guidance that they practice intense cleaning methods and social distancing. And I know full well that I sound like a broken record, but friends, I can't say this more clearly. The threat of COVID-19 continues to exist. It is truly deadly, and it must be addressed. Let me also address some things that are missing from this amended Safer at Home order. My team and I are still actively working with associations and boards to address other closures that are not included in this new order. Little league teams, entertainment venues, concerts, these are all part of what makes a summer so enjoyable and so special here in Alabama. Our folks and Dr. Harris's team are continuing to work today and throughout the coming days to give additional details and guidance to these other vital businesses and sports. Our goal is to announce the next phase of our reopening, hopefully by the middle of next week. But this is all contingent on what happens with the disease and how we continue to respond to it. As Dr. Harris will share, we still have over 9,000 people who have tested positive with this virus. And I, for one, believe it would be much higher had we not taken the serious steps to slow the spread. So as we move forward together again, I want to thank the good people of our great state for remaining vigilant. Your efforts are paying off. Now I'd like to call on Dr. Harris to give his updates. Dr. Harris.
Thank you, Governor. Good morning, everyone. Thank you for letting me join you today. As the Governor mentions, we do continue to see disease transmission in our state. I do want to just pause and thank you so much for what you're doing. I really just commend you for trying so hard and working so hard to balance the health needs and economic needs of our state. These are truly difficult decisions, and I just appreciate so much what you've done with that. I believe that what you have done has kept people well and saved people's lives and protected our hospitals, and I'm just grateful to you for that. As we move to getting back to more activities and getting more people back to work, it is really more important than ever for people to understand the need to maintain social distancing, the need to maintain good hygiene. We have provided a lot of guidance to these businesses that will be getting back to some semblance of normal again, and we encourage them to take a look at that. It should be available at this moment on our website for groups like the close contact professions, for restaurants, for gymnasiums and athletic facilities. And we need so much for you to work with us and help cooperate with us, as you have been doing all along, so that we can protect the most vulnerable people in our society. Just to give you a quick update, we do have about 9,050 or so cases, just short of 9,100 confirmed cases so far. There have been about 369 deaths that we have confirmed so far. We have today in Alabama reported about 602 patients hospitalized throughout the state who have been confirmed as having COVID-19, and then another 348 or so who are hospitalized awaiting tests. Our test numbers have been over the past several days fairly flat. Over the last few days, numbers of 265, 268, 287, 231, one over 300, 253. So we feel like we're fairly stable in that category, and yet there's still disease transmission going on at a community level. And so we very much need people to think about protecting themselves, to do these things that we've mentioned around face coverings, around hygiene. If you're a person who's older, or you're a person who has chronic health problems, please try to minimize your travel. Please don't leave the house if it's not necessary for you to do that. You're certainly free to do that, but we want you to think carefully about those trips and just try to protect yourself as much as you possibly can. As the governor mentioned, there's some particular things about this health order that I'll just mention briefly. There is no longer a number associated with gatherings. We want all gatherings to maintain a 6-foot distance between non-family groups or groups of people who don't live together, so that you can minimize the risk of disease transmission. But there's no particular number associated with that. I think one particular implication of that has to do with worship services, with funerals and weddings and those type of social gatherings that all of us miss and want to get back to. This certainly, because we don't have a limit on the number of people, that certainly allows those. I would encourage churches and other houses of worship to please, again, look at our website for guidance that we have suggested there for people to consider. We just want you, again, to think about protecting those people who are most vulnerable, those people who would be at highest risk for disease if they were to become infected. We've had a number of churches reach out to us and indicate that they were going to continue maybe separate services for senior citizens, for example. Many of them who have not previously done webcasting and online services are going to continue that for the people who choose to do that, and we think that's a terrific idea for keeping people safe. I do think it's important to remind people, as we've mentioned before, the biggest single outbreak we have seen in Alabama's epidemic was associated with a church event, unfortunately, and this occurred really before health orders had been put into place, when we were just beginning to realize the significance of what was going on. But there were a couple of hundred cases and as many as, I think, almost 50 deaths, either directly or indirectly related to a single church event. So we certainly want people to get back to their normal worship as soon as possible, and yet please remember to try to make that as safe as possible for those people who are at risk. As we continue to get back to more of a normal economy, it's more imperative than ever that public health be able to test and do contact tracing on cases, and we've made very good strides in having these plans in place. The governor's office has been great to work with us and helping us to identify the resources to do that, and we really appreciate that very much. We have, again, as I've sort of given you periodic updates, we've continued to expand testing and are doing many more tests now than we have been doing before, more than ever. We have partnered with community health centers who are rolling out mobile units that will be in various counties, particularly our rural counties where we're not testing as much as we would like. And we continue to do testing through our county health departments and are increasing the frequency of those as well. We are working on contact tracing through a number of different options. We are working to utilize school nurses who aren't working right now, who have agreed to come on board and help us with contact tracing. We've also, again, talked to our community health centers about adding capacity for that and/or adding additional staff at public health to do those things as well. So all those are going to be very important to us going forward as we try to contain this. We certainly recognize that as we get back to normal activity, we'll have outbreaks that will occur, and we believe that we're prepared to deal with them and respond as quickly as possible and protect people as much as possible. So that's all the comments I had this time, and I'll turn it back to the Governor. Thank you, ma'am.
Thank you, Dr. Harris.
Governor, last week, as I remember, one of the reasons you said not all businesses were reopening was because the 14-day average of cases had not seen a significant decline in cases over 14 days. Looking at the WDHN tracker, the 14-day average looks fairly flat, and the 7-day average appears to show a significant rise in the number of average cases. Why are we, considering what the data is showing about the rise in cases, why have you decided to reopen the state now? What are you seeing in the numbers that we don't see in this WDHN tracker?
Well, the governor has the responsibility of looking after both the economic well-being of our people in the state, the economy, as well as their health and safety. And because the people of Alabama are vigilant and they're abiding by the rules, we do believe that it's okay to expand these orders and provide additional opportunities for people to go back to work.
Governor, what's your message to law enforcement officers that said they weren't going to enforce some restrictions based on churches, restaurants, and other things that will be opening on Monday? What's your message to those law enforcement officers?
Well, the law enforcement officers, if you're talking about sheriffs, they are constitutional officers, and I would just encourage them to abide by the law. Today we are relaxing the issue about the churches, and each minister or rabbi or leader of that faith will make that decision of how to manage people, because we're lifting, there's no restriction on the number of people as it has been, so maybe that'll help. We just got the budget last night from the House, and we're poring over it as we speak. So we'll pay close attention to everything. I will say that I called Chairman of the General Fund Budget, Steve Klaus, yesterday in advance of introducing the bill on the House floor, and told him that I wanted him to zero out all monies previously allocated to the governor's office. I didn't want a penny assigned to the governor's office. And if the people of Alabama, if the legislators are so adamant about having a say in this, I told him I was willing to give up all monies devoted to the governor's office and let the legislature have the total responsibility for spending the money and for developing the plans by which to spend them. And the CARES Act was an emergency appropriation provided by President Trump and the Congress to help those of us who are fighting this virus deal with the 369 deaths, and it's wrecked our economy, and our small businesses have been devastated, and some 430,000 people have lost their jobs. So it's just imperative that the people of Alabama get to have this money and that it be done in the light of day. And I also told Chairman Klaus that I hoped he would zero out the executive branch and give all the money to the legislative branch, and I assured him that I would not call them into special session until in such time the legislature published a list of what they were going to spend the money on and what amounts down to the penny. It's imperative that we have transparency in the budget process for the people of Alabama to know exactly where the money is going. It's supposed to be going to help those who are suffering from the virus, hospitals, nursing homes, education institutions, cities, counties, you name it. And we have experience looking back to the BP crisis where President Pro Tem and the Speaker of the House then, Mike Hubbard, saw that money went to places other than where it was intended. So we're trying to prevent that as well.
Governor, do you not fully trust state lawmakers to use that money for coronavirus-related expenses?
It's not a matter of trust. It's the way they've acted in the last several days, wanting to intervene and take over and decide how we're going to spend that money. And it's more important to me that the people of Alabama have complete transparency on where this money is going and how much. And my effort is to see that that is done that the money goes to the intended purpose to help people who are suffering from this virus. Yes, sir.
You mentioned that you may have another announcement about reopening the state next week. As we noted, the Department of Public Health has shown steady or in some cases higher numbers this week than last week. With that said, what do you need to see over the course of the next week that will influence your decision about possibly further reopening the state next week?
Well, a lot of that depends what we do next week on how people respond to what we're doing today. So we'll just have to wait and see and make a judgment at that time.
Are you confident that businesses will follow through on these guidelines?
I'm banking on Alabamians being responsible and rising to the occasion to provide personal responsibility to help us all fight this case.
We got one more.
Dr. Aaron, can you just kind of assess overall the trend? Is the outbreak, is the state getting better, or what's the status? What are the numbers?
Yeah, our numbers as you have seen over the past week, have been a little higher than they were the couple of weeks before. We do know that we've increased testing somewhat, so we're trying to sort out how much of the increase could be related to just testing and how much might be additional disease. It's probably contributed to by both of those. I would think would be playing a role there. As we look in rural areas, we do continue to find that, and I think nationally, what other places have seen is that this was a disease that first seemed to show up in really heavily populated areas with high population density, like New York and in California, in New Jersey, and Connecticut, and now rural areas are reporting more of that. So we have seen something similar. Our absolute numbers in rural areas aren't as high because the populations are lower, but we do have some increased rates there.
Are you still confident that the hospital can contain, have the capacity to handle the caseload without emergency facility?
Yes, at this time the hospitals are containing that without difficulty. There are hospitals are a couple in the state that are dealing with high numbers, but they've not asked us for additional help on that. They seem to be controlling those fine with the resources they have, and so we feel like that's going to continue. We obviously have the ability, I guess, to try to make some other determinations if we see a crisis occurring in a particular area, a particular facility, but so far they're doing a very good job of that.
To recap, the new stay-at-home order goes into effect on Monday, May the 11th at 5 p.m. That's this coming Monday, and ends on May 22nd at 5 p.m. And again, it removes the 10% limit at gatherings, and it means that beaches have no gathering limit, but they are still being very encouraged to keep that social distance. And restaurants can open with limited seating, and Governor Ivey said that means 50% capacity. Salons and gyms can open with 6 feet separation and are still subject to that social distancing. To learn more about Governor Ivey's amended order, go to our website, dothanfirst.com. And for what this will mean locally, how it will be affecting the wiregrass, be sure to tune in for full reports on our WDHN newscast tonight at 5, 6, and 10. I'm Amanda Arnold, WDHN News.
You've been watching a WDHN News special report.